Good evening, Karen here. Today I would like to share with you a condition known as hypertensive crisis because I usually do it online courses, which I tend to increase knowledgeability on people's, especially when it comes to condition management. And today I would like to share with you a condition known as hypertensive crisis. So what is hypertensive crisis? Hypertensive crisis is a life-threatening medical emergency characterized by severely elevated blood pressure of systolic of more than or equal to 180 and diastolic of equal to or more than 120 millimeters per mercury. Patient may have symptoms of hypertensive encephalopathy, that is include severe headache, confusion, nausea, vomiting, and seizures sometimes. So, hypertensive crisis usually pose a patient to a high risk for end organ damage, including hemorrhagic stroke, renal failure, heart failure, and also papilloedema. Papilloedema is the inflammation of the optic disc, and that's why most of the time this patient usually presents with a blood vision, or they don't see so clearly because the optic disc have been compressed by the high pressure that this blood is being pumped on by the heart, and results to this patient experiencing some kind of blood vision or not seeing well. So, what is the key importance when you encounter such kind of a patient? The priority nursing or either healthcare provision that you can provide to this patient is to do other neurological assessment, including the level of consciousness and also the cranial nerves, because when you have decreased onset of the level of consciousness, then it indicates the onset of hemorrhagic stroke, which require immediate surgical intervention. So, what is the treatment for this patient that they need? These patients usually need IV nitrite, that is nitroglycerins, and also sometimes our cases here in Kenya we provide hydralazine with a close monitoring of this patient, because hydralazine does a rapid reduction of blood pressure, and when you do the rapid blood pressure reduction to this patient, we pose them to other risks, including heart failure, kidney failure, and also sometimes myocardial infarction because of the pure perfusion that is happening on the heart, the kidney, and also on the brain. That's why it's important to do a slowly reduction of the blood pressure, so that you don't rapidly reduce it, so that we don't pose this patient to other conditions which we can prevent them when we give medication at a very slow rate, or we reduce the pressure at a very slow rate. And also some other medication are antihypertensive, that is nitropyrosides, nicapidine, and for our case we do normally have nifedipine as another way of reducing the blood pressure, and sometimes we use IV labetalol to reduce the blood pressure. And that's why it is important for us as healthcare providers to do close monitoring of the blood pressure, and more importantly, these patients usually end up being monitored in the intensive care unit, and that's why they have to be put on telemetry, so that at least we know the cardiac activity, so that we do observe whether these patients are having maybe supraventricular tachycardia or ventricular tachycardia, and so on, so that at least we know how the cardiac rhythm are happening. Are they going beyond the normal that we normally have on the cardiac activities? So So that is the most important thing that we have to do on this patient. So another thing, sometimes you may experience patients who have low blood pressure of less than 60 minimums per mercury, and sometimes we do also, it's also an emergency that these patients should seek medical attention, because if you don't treat these patients who are having bradycardia, then these patients are going to end up having more severe problem on their vital organs, the kidney, the heart, and the liver, because, and also the brain, because these body organs need a proper perfusion for them to function well, and also to not to bring other complication to our health. And sometimes these patients are given atropine so that at least to raise their blood pressure, so that at least we meet the threshold or the normal blood pressure, so that at least we make the proper perfusion of other organs, so that at least we end up having a healthy heart, a healthy kidney, a healthy brain, because of the normal blood pressure or increased blood pressure, which was initially affected by the bradycardia or low blood pressure of less than 60. So how do you calculate the normal mid arterial blood pressure, which is so important when we are managing these two conditions, either hypertensive crisis and bradycardia? So for you to, the normal the normal mid arterial blood pressure is usually 110 to 120. So how do you calculate it? So you do two diastolic pressure plus one systolic pressure, and you divide it by 3, then you get the normal mid arterial pressure that needs to be have by a patient, so that you consider that patient is having a normal cardiac activity or mid arterial pressure, which is normal, that is meeting the normal body perfusion of the vital organ. Bye for now, and kindly subscribe to my YouTube channel, so that at least we increase the knowledge and sensitivity and creating awareness for those ones who have been, maybe you have forgotten on how to manage some other condition, so that at least we increase more knowledge. And bye for now, we meet the other time.